Hi, thanks for joining us. We're here today on blockjocks.com going over the correct way to do a timeout. When we think of a timeout, the first things we ask are who needs to be present. At a correctly done timeout, both the nurse and the anesthesiologist taking care of the patient need to be there. The patient also needs to participate in the timeout. What is a timeout? A timeout is done to verify that we have the correct patient, that we know the correct surgery being done, that the correct block is being placed, and that we're working on the correct side. We also make sure to check that the patient does not have any allergies that will be interfering with the procedure. When should a timeout be completed? The patient timeout should be completed before any sedation is given to the patient. Should be done before the patient rolls back to the OR, before the block procedure. It also should be done after any position changes or if anyone taking care of the patient, whether the nurse or the anesthesiologist, have to leave the room for anything at any point in time. Where is the timeout done? The timeout is done directly at the patient's bedside right before the block is to take place. Why do we do timeouts? We do timeouts in our facility to help make it safer for our patients. We want to do timeouts to prevent any sort of wrong-sided block from occurring. We're going to go ahead and start with the first step of the timeout. Who is present there? We're going to observe the block nurse and the anesthesiologist checking the patient's name, verifying his date of birth at the bedside.
Please state your name and date of birth.
Thomas Scott, 12/19/1980.
Thomas Scott, 12/19/1980.
Okay.
Okay.
For the second part of the timeout, the nurse and the anesthesiologist will confirm both consents are signed. We will verify that both the surgical consent and the anesthesia consent are signed and dated.
Okay. This is Thomas Scott, and the surgery today is for a right wrist surgery. The surgical consent is signed and dated. The anesthesia consent is signed and dated.
Agreed.
Okay.
In the third step of a timeout, we will be looking to make sure that we have the correct site and that the site has been marked, that we have the correct laterality, that everyone is in agreement on the side that the block and the surgery are being performed on, and that we are in agreement as to what type of block is performed, and then the anesthesiologist will also make his mark where he will be performing the block.
One last time, confirm which part of the body we will be working on.
Right wrist.
Right wrist.
Okay.
Right wrist. Okay.
It's been marked by the surgeon, and we're going to go ahead and do a right supraclavicular brachial plexus block for that. So I'm going to make another mark where we're blocking.
And in conclusion, thank you for watching. We hope this video helps in the prevention of wrong-sided blocks and contributes to the elimination of not only wrong-sided blocks, but wrong-sided surgeries.